Been farming for 30 years. My dad started farming in 1960, and I took over the operation when he retired. I couldn't do anything else. Our insurance is how do we afford this, is what we were looking at before Loman-Ray came along, because it was very expensive. Coverage wasn't that great. It's the exact opposite once we switched with Loman-Ray.
Well, there's a lot of risks for farmers, and we try to give them options that they may not otherwise have if they weren't part of a bigger group, such as our Farmers Association, which would include farm owners, health insurance, crop hail, and many other options they'd have access to once they are part of the association. So the Farm Association basically brings a lot of like risks, whether that's a individual farmer or a farmer who has employees, and tries to bring them together in one large group. Right now, they probably just have access to an individual plan that's going to be much more expensive, higher deductibles, and those are things that we're trying to alleviate to make the farmer's life just a little bit easier.
The Affordable Care Act came in. We actually lost our coverage, so it got real expensive, and Loman-Ray was the first one to come out with a plan that actually grouped us all together again, so we could get it cheaper.
Health Alliance has been our health plan administrator for this large group association, being able to offer plans that smaller groups would not have access to otherwise. So not only are they saving money on premium, but they're actually getting a better plan design, decreasing their out-of-pocket risk for that year, which again puts them in a great situation when they're looking at their expenses for their family and their farm.
When you're working with Loman-Ray, it feels like you're working with people from your community. They know more than just what we do, but how we live and our families, and it worked great.